There are many men in the US who suffer with urinary difficulties. A small percentage of them are taking medications to help with their urinary symptoms. Jack was among one of them, but he sought a cure, and I want him to share his journey regarding his urinary difficulties. So, first of all, thank you so much for
Sure.
sharing your story so others can benefit. Tell us about what happened years ago. You were being treated by another urologist, but
Correct.
then you ended up here. What was going on back then?
Um, Back then, I was having erection problems, so I went to see my urologist, and they did several tests. It turned out that I had a hydrocele, so he worked on that, and then prescribed some different medications, which did not work for me at all.
For
And
your urination.
for my urination, yeah,
Got it.
I was literally near the end before I came to see you. I was literally getting up 12 to 14 times a night to pee.
How do you have a life?
Yeah. Ask my wife. I have no idea. It is not a life. I'm a 77-year-old man, and that was ridiculous. That's what finally drove me to see you. My other urologist just wasn't taking care of the problem, and
So medication didn't work.
medication did not work. And if I want my honest opinion, it may work for part of the population, but when I came to you, the thing I said is I want it solved. I don't want to take meds that prolong or disguise something. Let's just get it done.
So you were looking for a fix, a cure, and not a band-aid, which was the medication.
The medication is a band aid, and I did not want a band aid. I wanted a cure, which you gave me.
So before doing a procedure to cure you, we did some workup. I had you void into a device. We
Correct.
we tried to check your bladder function. I looked inside the bladder, and you may or may not remember seeing the blockage due to your prostate.
I remember you saying, "Oh my," but yes, that was a very simple test performed right here, and it was very obvious at that point that something needed to be done, and it wasn't medication.
And a lot of guys are very afraid of that procedure called cystoscopy, which is to look inside the bladder. In fact, as you said, it's super easy. I actually did it on my dad, not
Yeah.
once, but twice. And we're still talking. He's almost 93. He'll be 93 next month. So you had the cystoscopy, and I also measured the size of your prostate. We decided that you wanted a cure, and a particular procedure that I performed called a TURP
Sure.
was the way to go. So tell us about your experience regarding TURP. How did that procedure go?
That, in my opinion, was a very simple procedure. It was in and out of the hospital. My understanding is that um, it's done transurethral, and there's part of the prostate, which is enlarged, moved transurethrally.
Hmm.
And I would say probably, not even a week of being uncomfortable, but ice packs and so on, much like you would do with a vasectomy. And this is a 4 month follow up. And for the last 3.5 months, I haven't had a urinary problem. I get up once, maybe a night, if I quit drinking water by 8 o'clock. And the recovery time was minimal, and there's very little pain.
You had the procedure done at a surgery center.
I did.
And did you have to stay overnight at the surgery center or did you go home the same day?
No, I went home the same day, probably within an hour and a half of waking up.
That's a common thing that if you look at different websites elsewhere, they will tell you you have to stay in the hospital, etc. That's not the case for me. When I do this procedure, almost everyone goes home the same day. I would say 99.9% of patients go home the same day. In addition, something that is very feared by a lot of patients is that they're worried about the catheter, the tube draining their bladder. What was your experience?
I didn't have a catheter. Um, when we spoke at the beginning, the thing that really instilled my confidence was you said two things. One, you're not staying in a hospital. And two, I'm not sending you home with a catheter. I've had terrible experiences. I had a minor operation, remove my thymus, and they sent me home with a catheter. And that would have been a deal breaker for me. I wouldn't have done it. So, no, with you, it's easy. And I would suggest that you don't go read WebMD or anything about it. talk to the doctor because it will um, not scare people, but they will question the process, and it's simple. It's really easy.
So two things I'll reiterate. Number one, talk to the person who's actually doing the procedure. If someone is very experienced in doing this procedure, your mileage will differ from what you read online. So that's topic issue number one. Number two, you mentioned you were getting up 14 to 15 times a night, and after the surgery, you now only get up once a night.
That is correct. Yeah, it was. I actually kept a log when I first started talking with you because, sometimes you get up in a dead sleep, you go pee and you don't know it. And I would write it on a college ruled paper, and it was 14 times, a couple of nights in a row. It was ridiculous.
Wow. So after going through this TURP surgery, how has this changed your quality of life?
Oh, I would say immeasurably. I go to bed at night and I sleep. Maybe I get up once. I think it depends on if you're good to yourself and you stop your intake of liquids, a couple hours before you go to bed. You wouldn't get up at all. But no running to the bathroom, no immediate need to urinate, no driving down the highway looking for a gas station. It's been a 100% reversal.
Sounds like you're telling me that your stream has improved, your urgency of urination has gone away, and also the need to get up at night to pee has greatly diminished.
Absolutely. Not to be off color, but when I had it done, a friend and I were driving up north, and we stopped at a place and had a beer. And he said, "How about that TURP procedure? What do you think of it?" I said, "Well, Roger, I can pee across the top of your car now if you'd like to see." So yeah, the stream and the emptying of the bladder. It's I don't feel like gee, I peed, but I still have to pee. It's phenomenal. I recommend it to anybody.
All right. Thank you so much, Jack, for sharing your story.
You betcha. My pleasure. Thank you.
You're welcome.